Sorry for the delay of 5 minutes. It was some connection problem. Let us start the live session first. And before I answer some of the questions, welcome Dr. Joshi. And I want you to please start asking the questions so that the time is not lost. Yes. So welcome Dr. Mohan, Dr. Karmega, Dr. Joshi. Yeah. So we were just discussing last time about the cases or the remedies for monsoon season. I think most of the remedies I have covered in that YouTube live or Insta live, and sometimes I've told some cases also. Now I'll tell you a very interesting case. Let's let everybody join in and we'll discuss some interesting case. Hello, Dr. Babel, Rohi. An interesting case. Before I had a question on WhatsApp that how do you explain anxiety or how do you explain antagonism with herself? So I have put a rubric today on the YouTube. Antagonism, I had a very interesting case which I'll share with because that was a very live case, and there was one film celebrity which was there in my chamber. So we were discussing the case, and he told a very interesting thing, that suppose I have a fight with my wife and I'm not happy, and something went wrong maybe in the family, and next day morning I have to do a shooting of a scene where I have to show that I love my wife, that is the heroine and all, and a very romantic scene I have to shoot. So I have to kill myself and then shoot because I'm actually not happy, not wanting to shoot that, but still I'm shooting that. And that's a very interesting thing, that is antagonism with herself. And if you have seen most of the remedies that we have seen in that, Anacadium is there, Kalikarb is there, CPI is there, Lachesis is there. And if you have seen these remedies have both the elements. And that patient reacted very well to that symptom of antagonism because every time, he has to face this in, and the next day or day after two, he's unhappy, he gets unwell, and because of that, all disease started. Well, of course, I prescribed that remedy, and the patient is still well now. So it's a very short explanation of the rubric which a lot of people wanted, antagonism with self. Or example, it happens in today's scenario where you have to give competitive exams and you have want to do something, but you can't get marks, and somebody advises you to do something else. You don't want, but still you are studying, and all the disease, all the elements starts from there, and you have to trace the history, and you get maybe he's a successful doctor or an engineer or a chartered accountant or professional, but he was not happy in what he wants to do, and that's how you have to take that rubric. I hope you understood that because there were a few questions for that rubric, and I wanted to club that and answer this question today. So welcome Dr. Anvisha, Nigam, Jasmine Kohli, Moni, Steffi, Nigam, Ruhi, Babel, Dr. Madan. Few of them I missed because there are a lot of other online. So I hope you understood that rubric, a very important rubric to understand, because we hardly take that rubric unless we understand that rubric. We'll never be able to take that. Otherwise, you'll be on lost about that. Anacardium has two trains of thoughts, one condemning what the others want to do, and you'll be very, prescribing in those terms. But this is clinical, what I've seen in my practice. So I hope you understood that rubric and do use that in your practice so that you're able to understand the case better. Now, one more question I had. Of course, if I don't have live questions, I'll just take the questions what were there on the WhatsApp. One more case I have where the patient, it was not prescribed on the mind. It was basically prescribed on the similarity of body. So it's not important that when the patient is in ICU, and he's showing some symptoms, or like for instance, the patient, I had a case where the patient had a lot of coughing, admitted in the ICU, and a lot of coughing, not better, though he had some other symptoms of cardiac problem and all. But that symptom of cough was very prominent, and it was not going. And the patient told that whenever something happened, there was a lot of pain in the mind, and there was some discomfort in the region of pericardium. So what remedy comes to your mind? Anybody? What remedy comes to your mind? Whenever the patient says that whenever something happens to me or whenever I'm not happy with something, I cannot speak out, and there's a lot of pain, mental pain, as you say, and I got a lot of palpitation, I get uneasiness of chest, though it is not a structural symptom, but I get a lot of anxiety in the precordium. Which remedy comes to your mind, and what would I have prescribed in that case? Anybody? Try to now try to be very imaginative in, or try to interpret a rubric in a very different way, so that you are able to convert normal patient's language into a rubric form, so that you are able to prescribe very precisely. Urgentum nitricum, yeah, for a normal person maybe it is urgentum nitricum, but think beyond what what you have been doing in your practice. Anybody else? Urgentum nitricum is an out and out remedy where the patient is always anxious, there is always impatient, he's very hurried. That's urgentum nitricum. But anything else you can think about it? Calcarea ars, yes. Still a remedy for but if you have calcarea, there's always the calcarea always starts because of security. There's a problem in security, and calcarea starts. So we are not talking actually about the security part. We're basically talking where you have to understand the rubric. That's very important for us. To understanding the rubric is important. How do you take that rubric? In calcarea, the more there's need of security, but we are talking about the relation to the pain, the mental pain he's suffering through, and there is a lot of discomfort in the region of precordium, and palpitations, uneasiness, sometimes breathlessness. A very interesting rubric. That remedy, I don't think you must have ever prescribed in your practice or taken that rubric in your practice, but very important. Otherwise, you'll be lost in lot of prescribing of rare drugs and understanding some rare drugs. But common drugs have so many things, which you have normally missed and never taken care of. So that is called as anguish in the region of cardiac anguish. And a very beautiful remedy which I never thought about is spongia. Lachesis is not there. Lachesis is not there. Whenever there is anguish and you have lot of angina pectoris in relation to anguish, then you must think of arnica. But only anguish and no angina, there is discomfort in the region of cardiac region. Think about spongia, think about arsenic, of course, think about arnica. But two remedies which are very important in this case you must think about. First is spongia and second is arnica alba. If you remember, one thing I told you something about spongia. Only one marking drug, only one drug in that symptom, in that rubric. Anybody can remember that rubric which I told? It is one of the very frequently used rubric in my practice. I have been using this for the past 10 years maybe. When I came across spongia, apart from cough, I wanted to see something if spongia is indicated. That rubric has helped me, that symptoms have helped me to get lot of good results in my practice. Anybody? Thoughts tormenting. Could you explain or could you go further, Dr. Ruhi? Welcome, Dr. Moni, Dr. Always Jumla. Okay, I cannot get the name right. Okay, so thoughts tormenting, but why? That's very important in spongia. I think you all should remember, it takes a lot of effort to understand the remedy, then tell you the symptoms. So if you understand, it will be very easy for me to keep on answering few good questions. Spongia has a very interesting symptom apart from tormenting thoughts. Tormenting thoughts, there are a lot of remedies, and the first remedy is spongia. Anything else? Anything you can think about? Tormenting thoughts about some. No. Thoughts crowding and closing the eyes. No. I didn't tell that. See, whenever I'm telling you something, it's always clinical. It is always clinical. It is never theoretical, because we are practicing doctors, so it is very important to have more of clinical symptoms. Then you'll be able to be a good practitioner. Spongia, that symptom has never gone wrong in my practice. It has every time helped me. I told you there is a symptom called as tormented by some frightful scenes of some mournful events in life. some mournful events in life. Remember this word mournful. Fright, tormented by frightful scenes of some mournful events of the past. That is the only remedy, spongia, and you'll be surprised. If I'm not wrong, try to use this rubric in your practice. Don't always give ignitia or opium or acid force or nitramure. Use that rubric and just tell me how good the result is. The result will come in days. It is such a fantastic, especially in old. See, in old people, there will be a lot of mournful and tormented events. Because the life is full of those events. But in childhood also, I had a case where I told that the child's grandfather has expired. He was very attached to his grandfather. Every day when he used to come from school, he used to take the photo of grandfather and start weeping and start looking at him, carry the photo of grandfather in his pocket. Always that thought was then. After that, the patient developed recurrent cough and cold, tonsillitis and all. One dose of Spongia 200 cured the case. I did not tell you, especially in old, because in old you have to take something else, because in old these events are very, very frequent, so you have to take a lot of things. Of course, if that event is very precise, I'll tell you one more case also. The father, he was 70 years of age, lost his son who was about 40, 45, and the family collapsed because he was the only earning member, and used to always go and see the photo of his son and keep remembering every day, every night. And because of that, he had developed some disease. If I'm not mistaken, it was, I think, Parkinson. Spongia 1M helped him to recover fantastically. He's not taking an allopathy medicine, but Spongia 1M relieved the case. So these are the very interesting cases, which clinically I have seen in my practice. And you must also, if you get some results of Spongia in this case, do let us know so that we all learn with together. Yeah, that was Spongia. Homeo joined, welcome. So I hope you understood Spongia, and something of Drosera I also told you. It's important to revise, Like for instance, if you have alumina, alumina has a very, very interesting theme, Alumina has a very interesting, he has a problem of identity. Identity crisis is alumina. In the same way, related to enemy is Drosera rotundifolia. Don't always think Drosera about cough, cough, cough. Of course, it is there, but Drosera has a very interesting symptom. Surrounded by enemies. Enemies are following him, pursued by enemies. These are very, very horrible visions of enemies that you have to remember, of Drosera. Sir, can you suggest remedies for ichthyosis? See, if you open your repertory, and अगर आप देखते हैं इंद्रनील जी, इक्थोसिस के लिए सी बहुत रेमेडीज है. And when I started my practice also, I was very, very, what you call, repertory based, and open the repertory, and I just remember one case of hemophilia, and in repertory thalassemia, in repertory there's the remedy called carcinosin, and that led me to think that if in thalassemia the remedy is only carcinosin, so everybody will give carcinosin, everybody will cure the case, but it does not happen. So with repertory, you must always think about if it is syphilitic disease, you can take help of that repertory, but don't be very sure, because those remedies might work and might not work, because you have to take the whole case. It's in our autoimmune disorders. If you open the repertory, the most important 3 marking remedy, if I'm not wrong, is phosphorus, thyroidinum. I think radium brome is there, sulfur is there, mercury is there, lycopodium is there. But my dear friend, do take the whole history before prescribing, because it's an autoimmune disorder and the patient comes in a very, very bad condition, Emotion, the mother, father, the family, everyone disturbed by the condition. So take the whole history before you prescribe. Patient 60 years, coryza with sneezing, cold draft, aggravation near fridge, watery discharge, sleepiness after eating, offensive flatters, desires warm food, and drinks milk aggravate. So see, whenever you have a case simple of sneezing, and in most of the cases we see, in case of sneezing or in case of coryza, it is better by a worm. So if it is very, very much if it is very, very what you call 3 marking, do take it. But otherwise, you can take that symptom worm as a normal symptom of coryza. If you don't have any symptom, you can take that worm. But in your case, if you see, there are 3 4 symptoms where you have where you have written that warmth amelioration, you have written coryza, you have written what you call sleepiness. So there are few symptoms that you have to understand, and the remedy. Remedy, in case you must think 3 4 remedies, Dr. Madan. You have got weakness also. Think about arsenic, think about Moxol, think about Sabadilla, and think about Kalikara. These are 4 remedies. Of course, you repetize the case few and give. In my case, if I have got the case right, you can think about either arsenic or Hiparsal. Explain the fever antipyrinum. Yeah, antipyrinum sulfur, Hiparsal did not work. So think about arsenic, Kalikar, and Sabadilla. 3 remedies, very very important, and it covers all other symptoms also. Okay. Uh, Dr. Ansari says antipyrinum. Yeah, antipyrinum is a remedy which I used to use before in fever. Uh, when there was a case of fever and it was not working, actually the remedies were not working properly. I used to think antipyrinum would work very well because as the name suggests, it works like a paracetamol, but it is not so. I would request, if you're getting case of fever, you're not getting result, think of ferromphos. Think of ferromphos in LM potency. It would work wonders. It would basically work as what you call paracetamol. So antipyrinum, it has some symptoms where what you call, I have not have much results with antipyrinum, but symptomatically I can tell you something about antipyrinum. My suggestion would be still use ferromphos in LM potency, repetition, and you would get good results. Okay, now coming back to antipyrinum. Now, antipyrinum, as you said, I think phenazone, prepared from it is phenazone, and few symptoms which I have seen in my practice. I have hardly used in my practice antipyrinum, but I used to basically understand that remedy as one of the good drugs for leukocytosis. And antipyrinum, if you see, there are some symptoms which are very very important. If I'm not wrong, it has one symptom which is very very important, that is throbbing throughout the body. When the patient comes and tells you that I have throbbing all over the body, we normally try to give belladonna and ask him throbbing kahan, throbbing kahan. And there is throbbing all over the body. There is one symptom which I have seen of antipyrinum, very very common, and that has given me good results. Second symptom of antipyrinum, it's a remedy for coryza, where the coryza is very fluent. Coryza is very fluent, and there is a dull pain in the frontal sinus. That is the second symptom which I have seen in my practice. Third symptom which I have seen, a patient of antipyrinum sometimes says that when there is a lot of salivation, there is blood in the saliva. That is the third symptom which I have seen in antipyrinum. And the fourth symptom, what you call in antipyrinum, there is a lot of hallucination and there is a lot of fear of becoming insane. There are 4 symptoms which I have seen in my practice of antipyrinum. If you open Boric Mater Medica, it is written that the large doses causes profuse perspiration, lot of dizziness, and cyanosis. That is the 4 5 symptoms of antipyrinum, as I remember, which I have used, and I have sporadically used in my practice. Ferromphos I use basically for fevers now. Sir, my cause of lumbar canal stenosis gave arsenic symptom express but walks for little time. How should I proceed? Arsenic, no, Bryonia alba help. Yeah, Dr. Indranil, if you have cases of where there's a spinal problem, I think I discussed a case of lumbar metallicum, of a spinal problem. A doctor who could not sleep, he said, I was very happy while sitting, but as I lie down, the pain starts. That is lumbar metallicum. So welcome Dr. Shreyesh, Dr. Ojas, Dr. Divya. If Bryonia alba has not worked, that means, or see, in spinal problem, it is not that your remedy has not worked or worked partially. If the patient takes care of the spine, does not bend down, does not do heavy work, or does not sit down, normally the pain becomes better. So you cannot be very sure that Bryonia only worked partially. In these cases, you have to be very sure that how is the patient feeling mentally. If bryonia does not work, I can tell you some symptoms of remedies which follows bryonia, but that would not work because I still doubt that. I don't know why did you give bryonia. So if you give me some symptoms of remedy, I can tell you whether bryonia is right or wrong. But if you feel that bryonia is right, there are some remedies which are complementary to bryonia, and the first remedy complementary to bryonia, you must think about Rustox, which matches with your symptoms. Second is sulfur, and third is Kalikarp. All the three remedies have action on spine and matches the symptoms of bryonia. Yeah, I have a webinar on 19th, Wednesday, 8:30 India time on Zoom. Patient told all the symptom of bryonia. रेस्ट with the keen symptom. या इन डॉक्टर इंद्रनील ये बात देखिए कि स्पाइन सिम्टम के अंदर ही ना, जब मैंने दो तीन चीज़ बताया आपको, बेटर बाय रेस्ट एंड बेटर बाय प्रेशर, कभी कभी थोड़ा बहुत हल्का बहुत मालिश करने से पेशेंट को ठीक लगता है, वो नॉर्मल सिम्टम रह जाता है. बट आपके अंदर दो तीन रेमेडीज बहुत इंपॉर्टेंट है. इफ आप मैथमेटिका खोल के देखते हैं तो कॉम्प्लीमेंट्री टू ब्रायोनिया एंड फॉलोज वेल टू ब्रायोनिया इज बोथ कंडीशन में रस्टॉक्स होता है. फॉलोज वेल में काली कार्ब भी आएंगे और सल्फर भी आएंगे. सो स्पाइन के अंदर इंपॉर्टेंट सिम्टम ये देखना आपको है इंद्रनील जी, कि उसको स्पाइन खराब क्यों हुई. रीढ़ की हड्डी, उसकी बैकबोन गई है. लाइफ में ऐसा कोई इंसिडेंस जिसके ऊपर उसने बहुत भरोसा किया, जिसके ऊपर बहुत डिपेंडेंट था, सडनली वो चले गया कुछ टाइम के लिए एंड द बैक बिकेम वर्स. वो आप पूछे केस टेकिंग में और आपको अच्छे इंपॉर्टेंट सिम्टम मिलेंगे पेशेंट के अंदर. बेटर बाय रेस्ट वॉज द की सिम्टम. या बेटर बाय रेस्ट इज अ की सिम्टम. व्हाट आई फील इन माय प्रैक्टिस, मैंने बहुत केसेस देखा हूँ जिसके अंदर ये समटाइम कॉमन सिम्टम हो जाता है. Lying on affected part emulates bryonia. Yeah, it is there. It is there in bryonia. Okay, Dr. Raha, rest is required. So we have taken note and we'll do that. Knee and hand joint pain, same time left chest, but echo report normal, negative ASO, positive 250, ASO 250 homeopathy. Yeah. If anti-streptolysin is positive, make sure that you go to the history of SORA, because recurrent tonsillitis makes the infection from tonsils to go to heart and the patient ASO titer increases. It is not always that in heart you can see some positive changes or in echo you get that, but it happens because of that the ASO is high. So कौन सा रूब्रिक लेना चाहिए मुझे बताइए डॉक्टर प्रधान. एक ब्यूटीफुल रूब्रिक आज आपको मैं एक मास्टर की दे रहा हूँ. अगर ये आपको मास्टर की मिल गई, आपको एटलीस्ट ये पता पड़ जाएगा कि प्राइमरी रूब्रिक क्या लेना है, यू नो. और रिकरेंट टॉन्सिलाइटिस के बाद ही हो रहा है, सो आप प्राइम एंटर कैसे करेंगे केस को, वो बहुत इंपॉर्टेंट टर्न. मैं दवाई तो आपको बता दूंगा, बट आप एंटर कैसे करेंगे, तो एक अच्छा रूब्रिक मैं आपको बताता हूँ आज. सभी लोग सुन लीजिए, एवरीबडी लिसन टू दैट. It's a fantastic question, and I have previously I also had difficulty in solving these cases, but I got that rubric. Most of the case you enter from that rubric and you will get the remedy. So which remedy you will take for prescription rubric will you take to enter the case? Anybody? Dr. Pradhan's question. Anybody? So हमने there is one rubric डिसेंडिंग अफेक्शंस. नो, अगर आप फाटक रेपेटरी यूज करें उसमें एक वर्ड यूज दिया कि भाई पेशेंट बोलता है मेरे को आई गॉट कोराइजा एंड आफ्टर सम टाइम आई गॉट थ्रोट एंड नाउ आई हैव गॉट अस्थमा. सो डिसेंडिंग कंप्लेंट्स. दिस इज नॉट डिसेंडिंग. फ्रॉम थ्रोट इट इज गोइंग टू हार्ट. डॉक्टर साहब, आई हैड कैंसर ऑफ नोज बट आई हैव गॉट सम सिम्टम इन रिलेशन टू स्पाइन. इट इज सेम. What is we are talking about? Anybody? So when in cancer you can think about, doctor, I had got cancer of nose, that is cured, but now I have pain in the spine and the doctor said there are some hot spot on the spine. You can't say that descent. Yeah, this is metastasis. Fantastic, Dr. Belwalkar. This is metastasis, and make sure whenever you get this, if you use in cancer the rubric metastasis, it is normal, Everybody has some metastasis. Descending basically is the progress of disease in Fatak repertory. But here we are talking from the throat, it has gone to the heart. Or in sometimes the patient says that I had a nose problem and now that is gone. But suddenly now I've started getting stomach problems. So we have one more rubric, metastasis from one disease to another. And the only remedy in that rubric is abrotenum. Are you getting the point? I hope you're getting that. It's a fantastic rubric, So, yeah. No, Soric, no. whenever, yeah, you can think about that rubric, you can think about all. If you see the remedies also, in those cases, calcarea is there, calcarea floor is there, pulsatilla is there, aborotinum is there, sulfur, every remedy. So every remedy has that sorozygotic syphilitic phases, no? So if you want to cure a case, make sure that you take a rubric which fits into the case, that's the art of taking that rubric. So it is fantastic, and I'm very happy that you're understanding the rubrics. With that, you can cure any disease. It's a fantastic rubric. And everybody, okay, you join on 19th July for 8:30 Indian time for migraine. Yeah. So I think it's already 3:30. Any questions left to be answered? Dr. Sisodia. I think she joined late. So you can take that, uh, before I wind up that, I hope there's no question. I just had a case, where the patient was working in a mine. And he had this problem of chronic gases and flatulence and lot of bloating of abdomen since lot of time. He took lot of antacids and enzymes and all, but he was not recovering. A stage came when he suffered fatty liver grade 1. So he came to me. So just by the occupation, mining, because of that, the patient had a problem. I gave a simple remedy, Karadusmar, and the patient got cured within 1 month of time. So this is how you have to interpret the patient's occupation, what he's saying, where he's there, how he's talking, how he's looking. That is the art of homeopathy, So it is not only when the patient tells you symptom, you understand the case. Without telling symptoms also, you can understand the case. See, gases problem, enzyme problem, because of working in mine. So ill effects of mining, there are so many drugs. One of the drug is Karadusmar. Karadusmar's 200 cured the case in a month's time. So in homeopathy, that's why it's called as art. And you have to master that art and be very circumspective. Open your eyes when the patient comes into your chamber, and understand how he walks, how he talks with the assistant doctor, how he talks with you, what he does, what's his occupation, and that's how you can get the remedy. I hope I'm very clear in what I want to pass the message to you all, and I hope you become better practitioners in your life, in your practice. Sir, homeopathy for OCD. Asim Khan, that day question is taken. It's already 3:30. I have one webinar at 4. So next time I'll definitely answer that question. So my dear friends and doctors, thank you for joining me, and I hope you enjoyed as much as I enjoy, and I keep enjoying teaching you. Thank you so much.